Maine's Democratic Governor Janet Mills announced that beginning on October 29th, all healthcare workers in the state must be vaccinated. And of course, once that was announced, it led to a wave of healthcare workers, nurses, claiming that they would immediately quit, that they are not in favor of these vaccine mandates, that it's wrong. And look, the thing is, it turns out, and we were suspecting this, that the squeaky wheel tends to get the attention, but it's very few of them. And when push comes to shove, ain't nobody gonna quit their job. Now, a few people did, but the numbers here are fascinating, okay? Turns out that most of these protesters were, might have been huffing and puffing, but they didn't actually end up quitting. Employment data shows that very few Maine healthcare workers have quit their jobs over the recent statewide COVID vaccine mandate, despite a number of lawsuits and ongoing protests organized by anti-vaccine activists suggesting that opponents of the mandate represent a vocal minority. Now, I want to give you an example of some of the, huffing and puffing that took place following the mandate. This is State Representative Laurel Libby, who's rallying healthcare workers to walk out of their jobs.
What are we prepared to do to protect our rights and the rights of all who come after us? Are we willing to lose our jobs? Are we willing to leave healthcare? Are we willing to walk out in a coordinated effort? That goes counter to everything I ever learned as a nurse. We do not abandon our patients. So are we prepared to do just that?
Now, let me just say that this state lawmaker has the right idea, right? One of the most powerful ways that workers can apply pressure and get some things accomplished, whether it's better pay or better working conditions, is by withholding their labor. So it's nice to see a lawmaker, although this is on a state level, pushing for workers to flex their power. Great. Now, the truth is there were already vaccine mandates for healthcare workers, and when push came to shove, most of them are like, yeah, I really like using this as like my culture war identity, but if I'm gonna lose my job, I'm just gonna do the vaccine. So let me give you the numbers. During a September 1st news conference, Northern Light, the second largest healthcare provider in Maine, said that only 20 staff out of more than 10,000 left their jobs over the healthcare worker vaccine mandate. Some more data for you. So Maine Health, the largest in-state healthcare provider, shared that only 0.19% of their workforce has quit in protest. So again, we hear a lot of the loud huffing and puffing by various people. They get a lot of coverage in the media, but it turns out that vaccine mandates do in fact work. And again, let me just repeat myself, for healthcare workers in the state of Maine, there already were vaccine mandates in regard to other diseases and illnesses. Healthcare providers already require their workers to be vaccinated against measles, hepatitis B, and other infectious diseases. Mills's mandate adds the COVID vaccine to that list. And on Monday, the Maine Centers for Disease Control and Prevention reported that a record 214 individuals were currently hospitalized with COVID-19 in Maine, the highest number since the pandemic began. And of course, as we know, the vast majority of those hospitalized with COVID are unvaccinated. Woz.
Yeah, look, the thing about, I can understand the objection to vaccine mandates writ large, right? Like if somebody's like, well, why should I work at Target and have to be vaccinated to keep my job at Target? I have sympathies towards that argument. Again, don't kill me out there. I got vaccinated in April, y'all. I was ready, willing, and able as soon as they came available to me. But I can understand somebody's objection to that. But when it comes to the field of healthcare and providing help to the sick, the most vulnerable people within our population in a job where you're already mandated to be vaccinated against other sicknesses. This argument just doesn't hold muster to me. It makes no sense. And as the numbers so clearly demonstrate, these loud people, talking about I'm gonna quit my job, I'm gonna walk off, I'm gonna do this, I'm gonna be big and bad. As the kids would say, Anna, it's cap. It's posturing.
It is posturing. But okay, let's just quickly break down the psychology behind it though, because I get the psychology behind it. It's the same psychology that leads people to be pricks on Twitter, right? Because everyone feels so helpless and powerless. And our politics has devolved into nothing more than culture war issues or cults of personality. And that's very much intentional by the elites, right? By the powerful, because it's a perfect way of getting people to focus on the culture war issues and get distracted away from actual issues that materially impact them, right? So working conditions, wages, the economy, taxes, all of that stuff. Lawmakers don't want to talk about that stuff. So the culture war stuff dominates, the personality dominates our political discourse. And so COVID ended up becoming, unfortunately, a culture war issue and something that gives people the ability to flaunt their political identity and feel like they're doing something. It gives people this weird sense of power when in reality they feel incredibly powerless. So with these nurses who were like, no, we're against the vaccine mandate, even though there are already vaccine mandates that we followed through on, right? For them, this was a political identity thing. And then once their material interests were at play, once those material interests were threatened, they're like, yeah, I'll find political identity somewhere else. I'll get the vaccine. You know what I'm saying? So I get it. I understand what's happening and what's taking place.
Yeah, and again, look, this is how people garner attention. This is what people think, honestly, is effective change making in their communities, right? Like getting up and being loud on the internet, on Twitter, on Facebook, on maybe getting a TV camera. New York Times might even come down and profile you and be like, oh, look at the weird hayseeds protesting vaccines, even though they're already vaccinated, right? Against other diseases. You're right. This is the economy that we live in, which is the attention economy, and people are gonna love attention, but numbers don't lie.
Exactly.
Everybody got the jab and moved on with their lives. Nobody grew a third ear. Everybody's fine. 5G is gonna get activated and we're not gonna turn into pumpkins. It's all good, Anna.
Yeah, well, just one, I guess, caveat. Everyone is not fine. Unfortunately, there have been people who took it too far, didn't get vaccinated, ended up hospitalized and died as a result of that. There was this incredibly heartbreaking story in California where both parents of a family of, I believe they had 5 kids, if I'm not mistaken, but now 5 kids they're orphans. They don't have, both of their parents got sick and they died because they refused to get vaccinated. I'm not saying that to in any way make light of the situation. This is not a haha moment. It's tragic. It's super tragic. So for the people who made this an unnecessary culture war issue, lives were literally lost as a result of that. So not everyone is fine. A lot of people died that did not need to die. But I'm really happy to see these healthcare workers, switch gears once they realize that, yeah, maybe my job's pretty important and I'm already vaccinated against a bunch of other things. What's one COVID vaccine to add to the mix?
Thanks for watching The Young Turks, really appreciate it. Another way to show support is through YouTube memberships. You'll get to interact with us more. There's live chat emojis, badges. You've got emojis of me, Anna, John, JR. So those are super fun. But you also get playback of our exclusive member-only shows and specials right after they air. So all of that, all you gotta do is click that join button right underneath the video. Thank you.